People will witness someone engaging in an unhealthy behavior, knowing that it's going to negatively impact them, and they won't say anything. My man, that
Oh
jada
yeah.
make it to the make a drink now. Oh, now, my man, that I get just,
Oh
just like,
yeah, yeah.
so you're watching the person self-destruct
Mhm.
and you're not
Correct.
saying anything. How
Right.
many people have we seen that have lost their lives to alcohol? And I,
Correct.
I I pointed out alcohol because that's one that's big in our community,
It's
and that's
terrible.
one that we like to normalize and pretend is not problematic. But you
Right.
see, this person goes out and they get wasted almost 4 or 5 days a week, sometimes even more, and
Mhm.
nobody is saying anything to them.
Right.
Is that really helpful at all? Welcome, everyone, to the Bare Naked Podcast. I am your host, Dr. Simmons. The Bare Naked Podcast is about truth and authenticity. It is about creating an atmosphere where we could have courageous conversations about difficult topics without judgment. Our goal is to cultivate an atmosphere of healing, understanding, and transformation. If you're new to our show, welcome. This is an awesome one to be at. If you are a returning listener, we're so happy to have you. Today, I am incredibly excited to have a conversation on a topic that's so crucial to and relatable to a lot of us. We're going to be talking today about navigating addiction and substance use. Now, in all of my thinking, I couldn't think of a better person to have speak on this topic than a wonderful young lady. When you see her, you'll understand. A wonderful young lady. Her name is Mrs. Hello. Maima Fortune-Grayson, and she is a psychiatric nurse practitioner. She is very well versed in this area, and I'm so grateful to have her on the show today. So, without further ado, I would love to introduce you all to Mrs. Maima Fortune-Grayson. Please introduce yourself to the audience.
Hello, everyone. My name is Maima Fortune-Grayson. I am a board certified psychiatric mental health nurse practitioner. I have been practicing for the last 5 years. I do work in the hospital and outpatient settings, helping navigate and treat mental health disorders that includes addiction, which is the topic we are going to be discussing today.
Nice, nice. On a more personal note, I'm just always so excited to see another Liberian, black woman doing her thing. And it's hard to navigate this world of medicine and it being in the professional setting to begin with. But it's so there are no words to describe my level of excitement when I see another woman, another black woman, another African woman, another Liberian woman, to be even more specific, doing such great things. So I commend you. I'm so proud of you and just thank you for everything that you're doing beyond on behalf of all of us in the community, all the women that look up to the work that you do. I really just want to thank you and thank you for joining our show, the Bare Naked Podcast.
Thanks for having me on your podcast today. I am looking forward to having this conversation about addiction with you and hopefully we can help someone through this process that's going through addiction at this time in their life.
Absolutely. So let's jump right into it. Let's jump right into it. We hear the term addiction get thrown around all the time. Oh, they're addicted to this, they're addicted to that. But fundamentally, what is addiction for those that are out there trying to figure out what do they mean when they say addiction? What's addiction from your perspective?
In my perspective, addiction is a chronic neuropsychological disorder. And basically, what that means is it's categorized by the uncontrolled urges to use, be it substance or engage in addictive behavior, despite harmful circumstances. So we continue to use the substance or engage in the behavior like gambling, overeating, as well as alcohol, opiates, heroin, marijuana. So when we engage in those behavior, what happens is it activates the reward system in our brain, which make us want to continue to use those substance.
Beautifully stated, so succinct yet, well put. One of the things that you mentioned was that with addiction, there's a continued kind of desire to use in spite of harmful consequences, right? That
Correct.
if I do this, this is what's going to happen, but we do it anyhow. So,
Mhm.
what is it that causes a person to pursue a particular behavior or continue to do something, even though there are harmful circumstances that comes with it?
So basically, what we call dopamine, it's basically release. Once we engage in these harmful behavior, we release this dopamine from what's called a VTA, and that releases the dopamine to the nucleus accumbens as well as the amygdala and the prefrontal cortex. What that means is the nucleus accumbens, it's basically the reward and the pleasure center of the brain. So once we release dopamine there, it trickles down to the amygdala, which is the emotions, and that controls your fear or anxiety. And then that trickles down as well to your prefrontal cortex, which has to do with reasoning and decision making. So once you activate that, it's a constant pleasure. Once you get the pleasure, you want to go back and keep using the drug because it gives you the pleasure that you want.
Yeah. And that well stated, right? I was just thinking about how as humans, we are wired to be motivated by something. Like we want rewards, we want motivation, and is that thing that when used wisely, it's what drives us. It's that reward that maybe drives you to finish college and go to graduate school and want to get married and buy a home. All of those things, whenever we do those things, dopamine is released in our in our brains, and we feel good. It's a pleasurable thing. We're excited about it.
Yeah.
At what point, and this is like a little bit of a semi-complicated question, but not
Okay.
quite, so we'll just converse about it. But like, when does addiction, it's one thing to say, oh, I love to go shopping, right?
Yeah.
And I enjoy it. I feel so good when I do it. At what point does it go from being, this is something that's fun and engaging, that I enjoy, that releases dopamine or my feel good uh, principles in my brain? At what point do I go from that to now being, transitioning over to, this is more of an addiction and now I'm concerned?
It's basically when when we engage in substance use or addictive behavior where it become we cannot live without doing these things. So what that means is dependence, where you cannot be a normal person outside of the substance, or you cannot stop using, say, social media, for example. You continue to use social media regardless if it's harmful to you, if it's causing issue with your job, your friends, your relationship. You use these things because you get pleasure from it, from the dopamine that's released. And once that's released, you keep doing the same thing over and over because you want that pleasure from it. As far as substance use goes, once you become dependent on it, you cannot function outside of the substance. And then you have a higher tolerance to whatever substance that is. And what that means is you require more of the substance that you're using to get the same effect as someone who might use one or two times or just minimal use the substance. So that's where it gets complicated because now we get into the addiction part of it because require more of that compared to our counterpart.
So in other words, there's a build of a tolerance. Like I need, now maybe if I'm using the shopping example, right? Maybe $100 is what was all it took before
Oh,
to
what?
make me happy, right? And now I'm like, $100,
That's
I maybe
nothing.
I needed to be 200 and 500 and 1,000 to get
Right.
that same
Same
excitement or that
high.
level of high that I had before, right? So there's the, I can't do without it, and I'm
Mhm.
going to pursue it regardless of negative consequences. But then there's also the buildup of tolerance
Correct.
for the thing. Okay. All right. You pointed to this a little. Oh, go ahead. Go ahead.
going to say it gets complicated because, people tend to use more and more and more, and the more pleasure you get from whatever activities, be it substance abuse or shopping, and that's when the addiction part comes in, or be it sex, gambling, overeating. We use that and we're unable to create other healthy habits because we've created a surge of dopamine to the reward system, that these behavior is the driving force behind what we do. So now we lack the ability to create healthy habits like doing other things such as working out or going out with friends, playing with your dogs and stuff like that, because those might not give us the same pleasure as the substance use or overeating, shopping excessively, using social media excessively as well.
I'm so glad you mentioned that, which is a nice transition because I was going to ask you, because often when we think about, when we're talking about addiction or we're talking about substance abuse, the focus is always almost exclusively on like substances such as alcohol and opioids and things along that line. But we know that there are different kinds of addiction and it's not always limited to substance use. So we have like substance abuse. We have the addiction to that substance, but then there are also behavioral addictions, and you pointed to some of them. So let's just kind of think through. You mentioned the gambling bit, you mentioned alcohol. What are some, and then I talked about shopping. What are some other kinds or other types of addiction that people should be aware of?
Overeating, it's another addictive behavior. Sex is one of them too as well. That's another addictive behavior. So those two as well can get very complicated.
Yeah,
Also, social media, that's a big
big
one.
one.
We cannot forget social media is addictive behavior like activities because we get pleasure from social media. So we tend to use our phones all the time. There are people who basically stay on the phone 24/7. They even get in trouble at work for being on the phone because they cannot help it. They get that dopamine release and they use social media to kind of like a reward system. Like they might post something on social media to get attention. And because there's so many people liking it, they continue to post things, even though it might be harmful to them as an individual, but they can't help it now. They're addicted to social media.
Yeah, 100%. And you pointed. I love that you mentioned the social media component, right? Because I think so many of us have become heavily dependent on social media that we normalize the level of addiction. We think it's okay to be on our phone. Like if you just sit in a crowd, I'm aging us a little bit, but gone are the days where we would all go out to dinner and we're just sitting and chatting like we're doing now. Now you're out to dinner and everyone's on their
Everyone's,
phone.
yep,
Everyone's on their
yep,
phone. Nobody's engaging with each other on a,
no,
personal level anymore.
no,
And then even if you're at home and you're watching, do this for me because this is an interesting experiment to do for yourself. How often do you reach for your phone when it's not in your hand, even though you know that it's in your vicinity? But how
right.
often do you find yourself within 5 minutes you're kind of you're checking, you're checking,
Oh
you're
yeah,
checking?
very often, very often.
For some folks, every 5 to 7 seconds they're looking for their phone, and that is some scary stuff, right?
Yeah,
So,
just the social media addiction has really become very bad in this age and
yeah.
time. In my line of work, I see adolescents,
Hmm.
and
Mm,
there has been several conversation with them where there's a lot of bullying happening on social media, and even though these adolescents are going through this, they still can't bring themselves to shut the phone off. And several times they would be like, "Oh, I was online and this person was talking about me." And I said to them, "Okay, can we try to get rid of the phone for maybe say about an hour, or try not to check the phone just
yeah.
in case?" But they can't do that because they're so addicted. The pleasure, the dopamine released that they get from checking the social media with that search, they just want the reward. So it's about the pleasure. It's about the pleasure. We're checking social media. We're checking to see what this person doing, what did this person post, dating post, and it could be a problem. It's becoming a problem in this day and age. It's something we need to talk about as far as with that. I mean, adolescent, youth, adults, anyone, because it's becoming a really big problem.
Big problem. The other one you mentioned, you know, was shopping.
Oh yeah.
What is it about shopping that, kind of, we've pointed to it a little bit, but I think that's another one that people minimize. It's like, oh, it's nothing.
Yeah, I think I've seen that where you can split the payment in four different,
Course.
so they
Yeah.
yeah, they feel like if they're not spending like $500 in one sitting and it's split out into 4 or 5 different payments, they're not really using a lot of money, but that could really be a problem because if you say, for example, you go and spend your rent money or your light bill on those things because you get the pleasure from, sometimes they don't even wear the shoes. Say you buy shoes, you buy all these clothes, but you don't really wear this. But I think it's just the it makes, it's a feel good thing. It makes you feel good because you own these things, the designer purses, whatever that is, but they still do it. I mean, and that's what leads to younger generations sometimes will start dating for older people to give money because they want to have the pleasure they get from buying these things. So they go ahead and do things they got no business doing in the first place.
Yeah. Yeah. So let's talk about that piece, which is like the impact of addiction on a person's life. Because when you said, you may go and you're thinking, well, I didn't spend 500 in one place, but you spend part of your rent money
Yes.
on some pocketbook that you're probably not even going to wear. And then you're going to hit up somebody's phone and be like, oh, man, you think you got small 250 for me? I short more this month. Oh, you know what I mean? How does addiction impact individuals' lives?
The addiction has a really negative impact on people's life if we let it get out of hand.
Yeah,
And what I mean by that, it's when like I was saying, when people, spend their money for things that it was supposed to use for something else.
yeah,
Now you risk your mortgage or your rent not being paid. You risk you being kicked out of your home. You risk your car payment because if that was something you were supposed to spend on your car payment too as well, you risk that being taken away as well. So there's a lot of different negative impact of addiction. I mean, I'm sure as we go along, we'll get to some of those, but it can get really bad if you just want the pleasure all the time because you keep stimulating the reward system to give you more dopamine. And the more dopamine you get, the more pleasure you get from it. And the more pleasure you get, the more you continue to do the same thing because you want the same pleasure and the same high. That's why we get the rush from those things and we want that high from it.
yeah, yeah. And I was thinking about, in terms of, like you rightfully stated, it really has a negative impact in so many areas of our lives. You highlighted the financial aspect, and
Mhm.
then another aspect that we alluded to earlier is the relational aspect.
Oh, yeah.
If you're so focused on, your shopping, or you're so focused on gambling, or you're so focused on sex, or including pornography.
Oh,
Pornography is
yeah.
an
Oh, God.
that we
Yes.
didn't touch on. Like, people are like, I need it. You don't understand. The fact that you're thinking about it at work when you're supposed to be working, you're making errors, and you can't wait to get home to do
So
this
you
thing.
can, yeah.
Throw on your favorite porn star, all of those things. It impacts you, your daily life, right? So in terms of like work, or even relationally,
Oh, yeah.
when we go back to that, the pornography addiction, um I can't tell. I've worked with a number of people who it's impacted their marriages or their relationships, right? Because they're expecting a certain attribute, what they saw from whoever their star
Expectation.
was. Yeah, and like, that is not real life, and your partner's not out here doing the most, and so how it hijacks your reality of what intimacy looks like. So it affects your relationships as well. So work, relationships, schooling, financially. So all aspects of your life then becomes affected
Affected
by
by.
your addiction.
Yeah,
And
because it's hard. It's a hard disease to beat because there's just so many different like consequences of it. So
mm,
many different factors that play into how someone become addicted.
what are some misconceptions? Because sometimes we have like, okay, this person is addicted because, what are some misconceptions that we have around addiction that you've encountered in your line of
Are several misconception about addiction, and shockingly the most one you hear is, people be like, oh, people who struggle with addiction are not successful, they're not educated people, they don't have wives, they don't have kids. No, that's quite the opposite. Like I usually tell my patients, anyone can struggle with an addiction. It could be a neighbor, it could be a pastor, it could be a best friend, it could be your child, your parents, CEO of a Fortune 500 company. Anyone can, can struggle with addiction. So that's one of the misconception. Another misconception is people think, okay, people, it's easy to quit. The people can stop whenever they feel like it.
big
And I
one?
say today, addiction has a psychological, a social, physiological, and genetic and environmental factors, which can complicate cessation basically. So if you use substance like alcohol create a physiological dependence that can result in withdrawal symptoms when you try to quit. So
Yeah,
that could be life threatening and not require medical intervention. So it's hard to quit because now someone has a dependence on alcohol and the tolerance is hard. Every time they try to quit, they go into withdrawal, which is a problem. Or say they use opiates, the same thing goes for opiates. You go into withdrawal. And I think the same thing applies to gambling or overeating or social media. Like people become sad or depressed when the children, and says the parents say, okay, you cannot have your phone for like XYZ amount of time because you did so and so things in school. Now I'm going to take your phone away from you. They get very sad and like they can't function because they're so addicted to the phone.
yeah,
That's a problem.
yeah,
So another thing we hear sometimes is people say, okay, it's the person's fault that they become addicted.
yeah,
No, and I usually say, no one wants to be addicted. I don't know anyone that want to be addicted, just how no one wants to have a medical disease like cancer. But because addiction is a consequence of many factors, which, like I said, include genetics, how someone was raised, what they were exposed to, the trauma they experienced in their life, their ability to cope with stress, their beliefs about substance use, such as alcohol or opiates or marijuana. Because what happens is some people at home, you hear some people tell you, oh, me and my family, I hear that a lot in my work field. I'm like, oh, how did you start drinking alcohol? They say, oh, I started at like age 13 or so. Me and my
hmm,
family during meal time, we would have a glass of wine. It was one of those where it was okay to do. So they never thought drinking alcohol that often could lead to dependence or tolerance. And there's
yeah.
been so many other factors which influences a person to be addicted. So it's not their fault. They don't want to be addicted. It just happens to be their body, once again, their brain adjusted to the changes that they made from drinking alcohol or using opiates.
You really hit some key ones because I think those are the big ones that we hear a lot. And I appreciate you taking the time to just walk us through them because the big one is, when we think about addiction, we think, oh, it's a poor man's disease. It's for people that are like, oh, they're poor, they don't know. But you'd be surprised how many CEOs and physicians and businessmen and all of those, those
Lawyers,
various lawyers, successful individuals that have addiction, right? And some addiction are more obvious than others. When we're
oh yeah,
talking about like an alcohol addiction, you can smell the alcohol on the person. But,
oh yeah,
but a pornography addiction, it's kind of like it's close, right? It's a little bit more hidden. They maybe you
right.
may not be able to see it, but it has the same impact nonetheless,
Oh
right?
yeah, it does because people, and especially when it comes to pornography, I mean, the whole life is I know, I mean, people, they can't like every time you look, they're like watching porn or like in the bedroom, it's causing problems in a relationship because they want to play porn while they have sex with their partners, and it could be uncomfortable because porn, it's not real. You know what I mean? It's not the same as when you actually intimate with your partner. So they try to do the things they see in the pornography, which is really unrealistic because those people are paid to act a certain way and do a certain things. So you can't transfer that to your real life, if that makes
Yeah.
sense.
Yeah, absolutely, absolutely. And then the other thing is just like, oh, they can quit anytime. It's a matter of willpower. You
Yeah.
know, if they're just being that way, if they really wanted to stop, they would. And
Right. Like
what you
someone just
said was
woke up
just
and
not.
said, "Oh, today I'm just gonna decide to be addicted to alcohol. I'm just gonna
Mhm.
decide to be addicted to pornography or
Yeah,
addicted to my phone." But like, it's many factors. There's so many factors involved.
yeah,
Like I said,
yeah,
psychosocial, physiological, genetics, what you're exposed to, your trauma from childhood, how you cope with stress. Because some people don't know how to cope with stress, hence why they engage in these addictive behavior. And some people are more prone to addiction compared to someone else.
yeah, yeah, 100%. And I want to touch on something really quickly because you, as a prescriber, one of the big areas of addiction that we see is prescriptive meds.
Correct.
So,
Pain
like you
medication,
mentioned, opioid,
opiates, which
pain
is,
meds, oxys, and things like that.
oh yeah, oh yeah.
What do you see in your practice? I mean, what is it? What does it look like? What should people look out for in terms of like addiction to pain medications?
Usually, what I usually see is the misuse of the pain medication. What I mean by that is, say I see a patient today and I gave you a prescription for a 30-day pain, say oxycodone. Not me personally, because I don't prescribe oxycodone. But if say you go to a pain management doctor, because most of the patients that are addicted to opiates are in pain management, they will what we like to call is medication shopping. So what that means is they will see a provider today, get a prescription for 30 days, go to another provider within 2 weeks when they overuse the medication because they take too much of the medication. Now, that's what we mean when we say dependent. So now they can't function without taking so much of the medication, or they have a high tolerance to the medication. So they're taking too much. They're running out of the prescription ahead of time.
Yeah,
Since they can't come back to the provider that previously gave them medication, they have to go and find someone else. But
yeah,
what happens is we keep track of the medication on what's called PDMP, which is the monitoring system for benzos and opiates. So you go to PDMP, you put the person name into the system, and it show, okay, I just gave you a 30 days prescription for oxy. Why are you getting the prescription 2 weeks? So then you notice a trend. These people who are addicts, who are addicted to opiates, you'll notice a trend where the doctor shop, and they'll have different prescription from different doctors because once again they have a high tolerance to the medication and they've become addicted to the medication that it require higher dosage than someone else who just take it for regular pain.
mhm. Absolutely, absolutely. And that's a big one. I think like, in the suburbs, and
You'll be surprised.
Yes, you'd be very surprised. And
Mhm.
teenagers, I mean, someone will take their parents' pain meds and sell it.
Oh yeah.
It's at school and things like that. So don't think, well, I don't live in the city. That's a city issue. No, 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 no. In your
No.
little, fancy suburban home,
Oh,
and with all the private education, that's where, for me personally, that's why I see a lot of like opioids misuse. You'll be so shocked at what these kids get into. And so it's really important, when we're talking about addiction, and we're talking about it almost through the lens of adults, but we also have
oh
to
yeah.
be mindful, because if you have teenagers
Oh
and
yeah.
teens, they too are getting into that addictive type
Yeah.
behaviors earlier on, because of what you mentioned, the environment matters.
Actually, when it comes to obviously addiction really starts in adolescence between
Lesson
the
years.
age of 1 to 17 years old is where it's prevalent because that's when there's a lot of peer pressure. There's a
Mm.
lot of
And you
risk
mean 10,
taking.
10 to 17 years old, right?
Uh-huh.
10 to
There's a
17.
lot of risk-taking behaviors as well, where they think they're on top of the world. So they do a lot of those things where they pressure into using substance, be it alcohol, stimulants. That's another one I didn't touch base on. Stimulants. That's a prevalence of stimulants addiction too as well, where there's a lot of misuse of stimulants and there's a lot of taking of the parents' medication or taking it for ADHD, obviously, which is a big one, ADHD. And then these kids doesn't take their medication. They just wants to sell it to the friends who wants to abuse the stimulant and make more money out of it, really. But that's a
Mm-hmm.
whole different topic for another day.
I know it's like, part two of this
Right.
conversation.
It gets complicated.
It gets complicated. You pointed so well to the different factors or underlying factors that contribute to addiction. So you mentioned genetics, you mentioned the environment being one. You mentioned,
Yes.
I think, alluded a little bit to, yeah, to childhood experiences, right?
Yeah.
Of adverse childhood experiences or trauma that you faced when you were a kid. And then the other piece that can attribute that we see a link between addiction and this is mental health. So, can you speak a little bit to the impact of addiction on mental health rather, or the relationship between the two?
So here's the thing though, addiction has a significant negative impact on mental health if not treated. Because basically, if a person has an undiagnosed mental health issue, using substance, and when we say substance, obviously we're talking about cannabis, alcohol, cocaine, meth, stimulants, those all can worsen the person's symptoms, which then in turn create an unhealthy coping through self-medication. And that create where someone has developed a co-occurring mental health substance use disorder and a mood disorder, be it bipolar disorder, depression, schizophrenia. So, if the person doesn't receive treatment for the mental health and they engage in the substance, that could reduce the effect. Actually, what I meant to say, if the person is receiving treatment for mental health and they engage in substance use, that can worsen, reduce the effectiveness of the medication and worsen the symptoms. So, say for example, if you take in SSRIs for anxiety, depression, and you're drinking alcohol, given alcohol is a suppressant, the medication is not going to be effective. So what's going to happen is that could just worsen your depression. Basically, you just get worse more. Usually, in time, a lot of times I hear people say, "Oh, I drink alcohol because I can't sleep, and I use it to sleep." Okay, but if you want to take medication for sleep and you drinking alcohol, that's not going to help because it's gonna negatively affect the medication. So it's not a good thing to mix substance use with mental health. It's negatively impacted.
100%. And I think you pointed to the big ones, which is that a lot of times we see that there is a correlation or a strong link between mental health and substance
Oh yeah.
use or an addiction, right? So depression, sometimes we may turn to substances to kind of make us feel a little bit more elevated. I
Right.
can't tell you how many people, especially young adults, say to me, well, I just drink because I got to get a little bit loose. But then, like, it went from, maybe like one glass and, just to get a little loose to now it's more and more and more. And instead of it being just like on the weekends, now it's weekends and weekdays.
Days. Yeah.
So there you want to know your own history too.
Hmm.
Know your genetic history, know what,
Oh yeah.
because that's something we don't do a lot, especially, well, I'll speak in the African communities. You don't know what your mom had, what your
No,
mom had. You find out when you go to the hospital and they tell you, oh, you have this, and you're asking your mom, and your mom's like,
I
man,
don't know.
I know, but it's just like you need to know these things because they they determine you could be prone to an addiction, but you don't even know because no one talked to you about it. Oh, well, we did have Uncle Joe, but I think Uncle Joe, somebody just wish him. You know what I mean? Like, so we blame it on that as opposed to saying this. There is in fact a legitimate addictions history in our family. So be careful of how you use substances and things along that.
But basically, to speak to that, genetics plays a 40 to 60% chance of
Yes.
developing addiction if there's a first degree
Yeah.
biological relative has addiction.
Yeah.
That I mean, I don't know if me you talked about like the root cause. I don't think we've gotten to the root cause of addiction.
You alluded to it, but we might as well
But I
lay
think
it
I
out
can
here.
skip through that. But
Yeah.
this
Yeah.
obviously does not want single cause of addiction, from what we know. Like I stated earlier, the changes in the brain chemistry that affect the reward system, which I spoke to earlier, the mesolimbic dopamine system, it contributes to the development addiction.
Yeah.
So substances and the addictive behaviors, what happens, like I stated earlier, they create a massive surge of dopamine, which then in turn leads to pleasure. And then this pleasure creates the unhealthy drive to continue to seek out the substance or continue to engage in the activities. So when that happens, it decreases the drive to derive pleasure from healthy activities, which we talked about, like, meeting friends, hanging out, doing other things like that. And then genetic is the other component because there's a 40 to 60% chance of developing addiction if your first degree relatives have addiction. Then there's also the trauma part of it, which is what we were talking about. I think we just kind of been mixing everything in.
That
The
we
adverse childhood experience, which has to do with from 1 years old to 17 years old was what I was meant to say. Basically, if you experience some type of rape in at that point in your life, some type of deaths in your family, divorce, or like you saw someone got killed, all of those things as well has environmental factor, which also influences like easy access to drugs, like you have easy access to alcohol. There's always alcohol in your house, or like you see a relative who's easily available to give you marijuana if you need it. All of those factors has contribution to addiction. So we have to be very careful when it comes to addiction, what we do.
hmm? Speaking of being careful, what are some stigma and what are some barriers that get in the way of someone who's trying to seek treatment for addiction?
There's a lot of stigma revolve around addiction, and it comes to do with the fact that how initially we said, oh, we think it's educated people doesn't have addiction, but it has to do with what people think. Okay, people who use substance abuse are morally deficit, what is what I like to call it. And all of this is perpetrated based off the terms we use when it comes to substance abuse. So we such have abuser, addict, instead. So we have to change the way we view that. Instead of using substance abuser, we have to say, misuse of that. Misuse of X, Y, and Z as opposed to this person is an addict, this person is a substance abuser. And then sometimes it revolves around the fact that when people are actually in active addiction, they tend to steal and lie. So we don't, people tend to not believe them when they say something because given that they're using a lot of substance, they steal the lie to buy the substance, and people don't trust that, that's what they're doing. Then the fear also is judgment, right? So there's a lot of judgment from family, friends, loved ones around substance abuse, and then the fear that, oh, if someone know I'm using alcohol excessively,
Yeah.
X, Y, and Z, I might lose my job. Fear too as well, which is another barrier to people wanting to seek help for substance abuse.
Yeah. So those are the big ones because if a person is struggling and they're in essence struggling in silence for the most part, right? And then when it becomes public and they really, it takes a while for a lot of people to get to a place where they're ready to change, but
Correct.
now they want to change, but nobody trusts them. No one
Correct.
believes them. It's just like, yeah, 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 you said that last year
Right.
and
Exactly.
nothing changed, or you're probably just saying that so I can let you back into the house so you can steal
Right.
more things or
Still more money. Still more money. Because when people are actually in, I mean, I have personal experiences with that as well as professional experience. I've heard so
yeah,
many stories along
yeah,
those lines. People tend to lie. I mean, they're going to lie to you for money until they can use the money to buy the substance. And people tend to stop, what I like to say, ask for petty cash. So
yeah,
what happens is someone start asking you, can I get $5? Can I borrow $10? Or can you loan me $25? I'll give it back to you. So now what happens is when they try to change, then you don't believe them because from the prior experience, because you've lied so much about what you were doing. Now you're telling me, oh, I'm changing. But that's what people fear to get help because all the stigma and judgment from the loved ones and friends, and then the ones who have professional jobs who work. If they're abusing alcohol, they don't want to talk about it. They don't want to seek help because they're afraid that it would get back to the job and they might lose their career, they might lose their job. So now there's drinking in silence or using opiates, abusing opiates without actually getting the help they need because of all of these stigmas are revolve
Yeah.
around.
Yeah. So when we taking into consideration the stigma and the barriers to treatment, right? And knowing that, I've heard people say that even when you go, let's just say you go to rehab, that sometimes even they've had certain experiences in rehab facilities where they didn't feel that their counselor or the staff or whatever truly believed in them, or that they truly thought that they could in fact recover. When you're facing all of that, what are the paths to recovery? What can a person do to get help?
Multiple pathways to recovery though. There's several different ways you could go about it, like AA, Alcoholic Anonymous. You can do Narcotic Anonymous. There's substance abuse intensive outpatient program. There's residential treatment. Then not forgetting peer support,
Yes.
family support, faith-based program. And then we talk about what's called medical assisted treatment. So what that means is the combination of medication like methadone, Suboxone, or naltrexone, which used in combination with counseling and behavior therapy to decrease the craving for substance and prevent withdrawals.
Yeah, 100%. So you bang them out, you bang them all out. Beautiful.
I mean, because from what we notice, I'm sure you deal with that too as well. It's most effective when you seek a combination of pathways.
That's
So,
it.
you participate in like a clinical program such as AA, but you also in a substance abuse intensive outpatient program, which is a structured environment. So you could go for 3 hours, be in a group with people who have similar problems, as well as receiving counseling, seeing a psychiatrist, behavior therapy, all of those which are individualized to a person. But we notice with the combination, you engage in people as well, support group, all of that increase the likelihood of maintaining sobriety.
Yeah, absolutely. So you mentioned support group, right? And that's something that comes up over and over in the research. So aside from medications, aside from AANAGAs, Gamblers Anonymous, they have
I
everything
think
else.
for anonymous, I don't know. I'm just
Yeah,
kidding.
yeah. Listen, yeah, there's
I
something
think
for
for them
everyone.
light, they
Yeah,
definitely have gambling anonymous, but I don't know about the porn one.
yeah, if we don't have one, then probably there's a need for it. I can tell you
Well, I'm
that.
sure there is.
Oh, but aside from the support groups, and all the structured treatment, underlying theme that comes up a lot is the importance of having a support
So
system. So why is that important? What's important about being able, if you're dealing with an addiction of any kind, whether it's substance or it's behavioral, shopping, porn, social media,
sex,
what's this?
sex,
Yeah, all sex, food. You mentioned that's a whole nother thing
food,
by itself.
overeating. The amount of
Overeating, which
food.
is a huge one, right?
Yes,
All of us, I always say, do you stop at your natural pause? And people look at me real crazy, but like when we're eating, we all have natural pauses. Is the point at which your body kind of reminds you, you put your
it's too
fork in.
much.
I'm doing. You're supposed to stop then, but most of us don't. We
Right,
continue eating and eating and eating until we basically put ourselves into like hibernation, like food coma, and then we're like, "Oh man, I ate too much."
right.
That could be a problem if it's something you do day in and day out. But what's the importance of having a support system?
Having a support system is very important. Having friends, family, people involved in the recovery community is essential to
Yeah,
maintaining a sobriety. Because what happens, in substance abuse or addictive behavior is disconnection and isolation are the two contributing factors
yeah,
that keep people in the addictive circle, basically. So being connected, supported, and engaged in a multidimensional support system makes recovery possible. So what that means is just having someone there, be it a sponsor, just someone to talk to, someone in your family who maybe have gone through similar things in the past and have work through the steps of come to the point where they've been freed of the substance or
Yeah.
not addicted to be a gambling, porn, shopping, any of the addiction the person have done that. I think just having that support is very important. So we like to tell people, don't isolate yourself, don't disconnect, because those unfortunately are the two contributing factors that keep people in the addictive circle.
And I think what I would add to that is that, with addiction, we didn't spend too much time on this, but the aspect of relapse. That
Oh
you
yeah.
can do all of these things, and relapse rates are so high in addiction, right? And I think one of the things that help people avoid relapse or not going to relapse as much is having that support system. Someone that's like your accountability partner, someone that can be there to listen, someone that can give you hope, someone that's like they can know when you're slipping. They know when, because sometimes even when you are no longer utilizing the substance, your behaviors, you have behavior attributes of someone who is struggling with addiction, and so they see your behaviors and they know something's happening in there, but that person can kind of catch you before you
You
fall,
well, correct.
so I think when I think about the support system, I really think about them in the context of preventing relapse even.
Right. Like I
Yeah,
usually tell, people, be it relatives or someone I know, you can't go through addiction and wants to make a change, but still hang in the same environment.
that's
Because if
it.
you hanging around the same people who you used to use substance with, you're going to be tempted to engage in the same activity, but you have to clear out if these people are your friends, you're going to have to make new friends or stop hanging around these people, change your environment. Even if you have to move, there's times where I hear a patient tells me, I lived in X, Y, and Z area, and the reason why I keep using because everyone in the home are using, so it's hard to disconnect from that. But
Yes.
if you move and change your environment, say you change location, go to your uncle's house who there's no alcohol in his house, he doesn't smoke, he doesn't drink, nothing of that sort, it's easier for you to maintain sobriety once you outside of that area, which gives you easy access to the substance that you use.
100%. And I think the other thing that's kind of important, because you were talking about just changing your friends, it had me thinking about the terms in the addictions world of like people, places, and things, right? Like, you got to be mindful of the people. You talked about the friends and the environment, the places you used to go. You
Yeah.
can't be going to you can't frequent those same places.
Right.
Your dealers on the corner, on that corner. Why are you on that corner? Or exactly where mom keeps her
Purpose.
prescription, her perks. You know what I mean? Where she got her Percocets, where she got her codeine, and yet that's the only place that you want to put your stuff around there. You're
Right.
always navigating in that space, but you
Yeah.
really have to be so intentional about changing your
Yeah.
environment. So it's an internal change as well as an external change that's needed to maintain sobriety.
Yeah. Because as humans, we have urges, and you want to once again dopamine, it's very important. It's that pleasure, and sometimes you want to get back to what gives you pleasure, and once you get outside of the addictive circle, you might not find pleasure in other things, but you have to build that pleasure around healthy habits, be it exercising as far as going to the gym to create that pleasure, doing things of that sort as opposed to playing on your phone all the time, looking at social media, or using alcohol or marijuana. So you have to create healthy habits, really.
That being said, do you have any, what advice, right, would you give to someone who is struggling with an addiction or with substance misuse at this time? What would you say to them? What would you leave them with? What do you want? How can you help?
I mean, recovery is possible. That's
Okay,
a start. I mean, take your life one day at a time, one step at a time. You know, just try to enter. I usually tell people, just take it one day at a time. Try to enter a program, stay complete the program. Because what happens is I have patients tells me, "Oh, I went to substance abuse rehab, but I didn't stay. I left in 2 weeks. I felt better." I mean, I think it's worth completing the program. Like if it's 30 days, stay for 30 days, try to turn support group most of the days, even if you're not actively using substance. I think just being in that support group environment and having sponsors, people you can reach out to or talk to if you ever get the urge. So if you're in Gambling Anonymous or Porn Anonymous and there's a sponsor, someone you could call if you have the urge to want to pick up your phone and watch porn, that person can talk you through, if they've been through it themselves, someone who's have experience of done this for many years. Try to reacquaint yourself with who you are as a person, what you like, what you don't like. Get familiarized with your hobbies. And what I mean by that, because when you become addicted, you kind of lose track of all the things you enjoy doing, and your focus has become just on whatever substance or addictive behavior you've managed to engage in. So try to reacquaint yourself with your hobbies, things you enjoy doing, your passions that you used to do before you became this person who was addicted to this. And
Yeah.
keep in mind, relapse is going to happen, and know the difference between lapse and relapse. Lapse is if, say, you went 3 months without using, and I come to your house and you invite me over. There's a Christmas holiday party, and I stopped drinking alcohol or using, but then I got there and someone was using, and I decided to engage. That's a lapse, but once you remember to, after the party, not start using again, that's good. Just remember, all is not lost. Lapse happens, relapse happened, but just you did not feel you're worthy and you're valuable, and just continue to work on the problem. Everyone has a problem. Just make sure, just because you have addiction problem does not mean that you're less than someone else. Everyone's fighting the silent battle, and you're
Yeah.
not alone. There's providers out there, there's mental health counselors, there's therapists, there's psychiatrists, and you have people who wants to see you through the process, your recovery process. So just take it one day at a time, really.
Yeah, those are such excellent advice. And of all the things, there was, I love them all, but the two that stuck out to me the most was just like the importance of hope, that there is, in fact, hope, right? And sometimes when you're in the thick of your addiction, it feels like, man, I've dug myself in such a deep hole. There is no way that I can get from out of this. So I really love that you led with imparting hope that it's possible. There are individuals who have, in fact, gone through years of addiction and now they are clean and
Yes.
they're running their own businesses, they're doing their own things, they're parents with children and grandchildren.
Oh yeah.
But if you saw them then,
Oh boy.
you may have not felt the same level of hope for them, but somebody believed, somebody thought that, you know what, there's hope for you, I'm going to help you get out. So number one, there's hope. And
There
then
is.
what I liked, this gets missing a lot, is that you said reacquaint yourself with the things you used to enjoy,
Mhm.
because sometimes your addiction becomes the only thing you
Sure.
know.
Yeah.
Even when we said to assess people and you're like, what do you enjoy doing? They can't think of anything that they
Right.
enjoy doing anymore. But well, I used to love music. I used to play the guitar. All of those things have gone by the wayside. But reacquaint yourself with them, get to know them again. The challenge with us as providers, like as that are providing this kind of care, is that sometimes we tell people we pull the addiction out. We say don't engage in this behavior anymore, but we don't give a healthy substitute behavior for them
Correct.
to engage in. You
Yeah.
can't take something from someone without replacing that with something healthy. When you reacquaint yourself, when you create that list of things you enjoy, what you end up doing is then having things that you can substitute the unhealthy behavior or the maladaptive behavior for something more adapted or for something more healthy. So I think those are really excellent points, and I hope you all are listening. Listen, if you're struggling with addiction of any kind, right? Make a list of the things that are healthy. What are the healthy coping skills? What got you into that addiction to begin with? Because they may, more often than not, there are underlying reasons.
Issues.
Well, I lost someone, or I lost my job, or you know what, I hurt myself, and then they prescribed these pain meds and I can't be as functional as I used to, so now I became addicted to it. Get
Oh,
to speak
yeah.
with a professional. Oh, go ahead, please.
I said you see that in so many instances where, usually I would ask patients that when they come, especially the ones who are opiates
Mhm.
dependent, I'll
Yes.
say, like, what happened? Like, how did you get it? Oh, the ones that using heroin. I said, did you just start using heroin? And they said, no, when I was young or in my 20s, I hurt myself. I went to the doctor. They gave me pain medication and I just got addicted to pain medication. Now I've moved from pain medication. Now I'm doing heroin. From heroin, now we're doing fentanyl. And it's just kind of, honestly, I can
Right.
tell you, like, for example, I had a patient in the hospital the last time. And this man told me in 2023, he spent $200,000 on opiates, just between partying with friends, going to Poland, going to Mexico, going to Colombia, just using cocaine, they're using meth. And I guess there's a shortage of meth. So now they're using fentanyl because there's a shortage of meth. But $200,000 in a year just
Yeah.
on his addiction.
Yeah.
And he's created a healthy relationship with the people around him. His wife, he's getting into fights with his wife because it's a lot of money to spend on substance use, but addiction. It's a hard thing to beat, and
Yeah.
it takes a lot of time, a lot of patience, and just to continue to do the work.
Yeah. And don't think, oh, I got this. I'm doing it on my own. I don't need anyone's help. I don't need a professional. There are
Right.
people out there like yourself, like myself, who this is our bread and butter. This is our passion. This is what we've been trained to do. Go and seek out those individuals so that they can in fact help you, right? Don't try to suffer in silence. Don't try to do it on your own. I mean, I wish we could talk on this forever and
Oh
ever
yeah.
and you know.
Help is out there.
Help is
It's
out
out
there. Help is out there. So go ahead and get the help that's needed. And for those individuals, there are individuals with gambling addiction,
there.
and we could have done a whole thing on gambling addiction, but
Definitely.
because I've had people lose their homes, lose
Oh,
their marriages,
and
lose their
marriages. Yeah.
children,
Oh yeah.
lose their jobs over that addiction. That's something else that's huge, and it's like get off the sports betting apps. I think it's
That
yeah,
game is definitely a big one in the African
huge.
community as well. I've heard, I mean, personally, professionally, several instances where people don't pay their mortgages or they just don't pay the share of the mortgage. They take their paycheck. The first thing they do when they get paid is to go to the gambling and just the casino and just use the money that they're not taking care of themselves. They barely buy things for themselves because they spend other money gambling. But as African people doesn't believe in therapy, so instead of going and get the help they need, it's just that, oh, I'm going to stop. But they fail to understand addiction. It's not something, it's a chemical imbalance in the brain. It's not something you could just stop after it's become so bad. You have to get help and you might need medication to curb the obsessive, because gambling is obsessive. You might
Yeah.
need SSRI to kind of help with that addictive behavior, so you don't keep doing the same thing over and over, because to some extent, gambling and those addictive behavior forms of anxiety.
100%, 100%. Oh, and before we wrap up, here's my final, maybe second to final thought for you. Is how what if there's someone out there that's listening that they know someone who is struggling with an addiction? How
Mhm.
can they help someone who their loved one that's struggling with an addiction?
And just be of support to your loved one, provide that comfort. If you as a person know an avenue that can help them, maybe point them in the right direction, as far as encourage them to go to counseling, encourage them to see a provider, if they need medication, because sometimes it just might just be therapy might help them through the process without intervention of medication. But I think it's just being there. I mean, addiction, I think people just need that moral support for the most part to kind of not feel alone, because it's easy to fall back into habits if you feel like no one cares, no one's there. What's the point? And the habits you see yourself in might just be the only thing you feel like you depend on. And the substance, once it's giving you that high, and you feel like, okay, if I'm high, I don't have to think about my problems. I'm just going to numb everything else and push the outside world out and just focus on that substance. But once the patient know there's someone there who's in their corner, it could be one person, two persons, it doesn't matter. Once they have someone there, they feel like, okay, X, Y, and Z care for me. I could talk to them if I'm feeling sad, if I'm feeling depressed. Because a lot of times people with substance abuse, addictive issues have underlying depression, underlying anxiety,
Yeah.
underlying bipolar disorder, mainly bipolar disorder when it comes to substance abuse. So I think just having someone there, it's really important.
Yeah, yeah, 100%. The other thing I would add to all of that is also just to be patient with the person, you know. Be patient. You're gonna have to, and not to bring scripture into this, but you have to. The scripture
Yeah,
calls it long suffering. Sometimes you have to suffer long with them. You got to be patient with them. You got to bear with them. It's not always easy. It's really hard, especially when you've been hurt as
yeah,
a family member. Um, but dig deep, know when to support and when to
right,
take care of yourself also.
right.
Know when to create healthy boundaries and when you can kind of open your arms and say, come on in. So I think those are some pieces that I would add as a person dealing with somebody with an addiction. It's like, be patient, be a support, but also create boundaries. The boundaries are meant for you. What you will take, what you will not take, it's for your own good. And take care of yourself, because it really truly can be exhausting living with, managing with someone that has that's dealing with addiction.
Yeah, and another thing would be, like um don't want the person to get the help more than the person wants to get help. And what
Yeah.
that means is what I see a lot of time is, I would talk to a patient about the substance use. They might not be there yet in as far as obviously, the stages of changes when it comes to addiction. They might be in the pre-contemplation stage, but their relative is in the contemplation stage. And the relative is telling them they have to do X, Y, and Z. And you talk to the patient, and the patient's like, I'm not ready to stop using, but I'll go to rehab for him or her. That never worked
Word.
out because they're not truly doing this for themselves. And what happens is us as family, loved ones, we want what's best for this person, but they have to get to the point where they want what's best for them. You can't make someone do something if they're not ready to make that change. And that's where the frustration on our part come in, because we get upset, we get frustrated, and we like don't want to be bothered with a person. But in reality, we did not let them get to the point where they were ready to make that changes in their life themselves.
100%. So since you're at it, any final thoughts? We've reached the end of our conversation. I've enjoyed so much of what you've had to share, just professional knowledge, personal knowledge, and they're practical. They're things that people can take and use. So I really appreciate that. I want to open it up for you if you have any last minute thoughts, any final thoughts to someone out there that's watching, either as a person struggling with addiction or as a person who knows someone that's struggling with addiction. What are some last thoughts you have?
Person who knows someone struggling with addiction, I would have to say, don't force people to change behavior, because what happens is if you force people to change behavior, they're going to do what's best for you, but it's easier for them to relapse, and that would keep them in the circle of addiction because they weren't truly ready to make that change. I see it all the time, speaking from an African, see it all the time where we're like, oh, Paul drinks too much alcohol. I want him to stop drinking alcohol. And then next thing you know, they go into medicine man or someone to get medication to give to Paul, John, and Peter to stop drinking. But in reality, Paul has not come to that realization where he's ready to make that change. And what he's doing is, oh yeah, I'm gonna take the medication, but he's not taking the medication. He might be cheeking the medication. He might not be going to doctor's appointment like he tells you he's going to. He goes and he doesn't do what needs to be done. And you're thinking, oh, Paul's getting the treatment he needs. But in reality, he's really not. He's just lying to you. I think we need to let people in our community educate them, tell them the benefit, the risk, the side effects, let them make informed decisions for themselves as opposed to impose our beliefs onto someone else just because we want them to stop doing something. So
Yeah.
please, please, please stop doing that.
Mhm. And then, something I would add to that is that sometimes, if we brought it just to our community in particular, right? People will witness someone engaging in an unhealthy behavior, knowing that it's going to negatively impact them, and they won't say anything. My man, that job they make a drink that. Oh, that my man, that I get just
Oh
you like
yeah, yeah.
you're watching the person self-destruct
Mhm.
and you're not
Correct.
saying anything. How many in our little young age, we won't give our ages away, but our
Come
little
on, I'm
young
too
age,
old.
our little young age,
Right.
how many people have we seen that have lost their lives to alcohol?
Oh yeah.
Like, or now they're like, oh, my man, they say I can't eat this, I can't eat that, I can't eat that because you've destroyed your body. And I,
Right.
I, I pointed out alcohol because that's one that's big in our community,
It's
and that's
very.
one that we like to normalize and pretend is not problematic. But you see, this person goes out and they get wasted almost 4 or 5 days a week, sometimes even more, and
Mhm.
nobody is saying anything to them. Is that really helpful at all? Because in just a year or two, we're going to be saying, Mama, that person died. Please you get $50 to contribute to blah, blah, blah. But you'll
Right.
watch the person self destruct. So I
Very
bring that
true.
up to say one of the ways that we can help each other is to like speak up earlier rather than later. If they refuse, they refuse. But don't just watch it and sit back and you see the person spiraling downward and you're not doing anything. Say something, offer help. And if they refuse your help, that's fine. You've done your part. So I would add that to there
Yeah.
too. Yeah.
Definitely encouraging though.
Yeah.
Alcohol is definitely a prevalent one in our community. Definitely. It's
Yeah.
almost normalized, really.
It is. It is normal. And you're looked at strange if you don't really drink like that. What wrong with you? This is like, yeah.
Me, I know that, it's funny because I drink Wet Claw. I don't really drink alcohol,
Mhm.
but every so often I'll drink. I don't know if you know what Wet Claw is. It's basically seltzer
Like so,
water.
yeah. Yeah.
But and then my friend will be like, "Let me guess what you're doing, drinking Wet Claw," and I'm like, "Yeah, I mean, it's not really. I don't want to drink alcohol like that, but I mean, I do drink. Obviously, it's different. You know what I mean? There's moderation for everything. If you socially drinking, where you go out with people and you guys engage in alcohol, okay, cool. But to just be at home and just drinking, I mean, you see that all the time. But
Yeah. Yeah. All
that's a
right.
different. That's a whole nother topic for
Another topic, another ballgame. We wanted to lay the foundation for addiction and substance
correct.
use. And
Addiction just have so many parts. We even touched the basis of the corner of it. We just kind of tip
yeah,
of the iceberg, but
tip of the iceberg. Yeah. Yeah, but listen, you delivered above and beyond what I could have asked for. In all honesty rather, I really appreciated you taking the time out of your work today and out of your busy schedule. Out of your busy schedule, you took the time to meet, to share your knowledge, your experience, your wisdom with all of us, and so for that, I say thank you.
oh, maybe.
Well, I guess before we wrap up, where can they find you, if they wanted to get a little bit more acquainted with you and your work, and if they needed support, where could they find you?
Well, currently I reside in Georgia. So I do have a license to practice in Georgia, and I do have my private practice. So you can find me on social media, Maima Fortune, or you can look up Fortune Global Psychiatry, which is my private practice. I see individual from 18 years old to all the way to older adults. I provide psychotherapy and medication management for those people. You can find me on Facebook, Maima Fortune-Grayson. See,
Nice.
I remember to put it in.
That's
Maima
right.
Fortune-Grayson. Facebook, I'm there. Also, I do contract with growth therapy. I'm sure you know growth therapy. I contract with growth therapy and see the patients too as well. So if you look up for providers agrotherapy and put my name into the system, you can see me. And if you need help and you need to come and find me for medication management or psychotherapy, you can find me on there and just have my availability on there as well, and make an appointment, come see your girl, and we could go from there.
I love it. I love it. So thank you all for joining us. I have had a blast during this podcast. I hope you have as well. Enjoy. Make sure to like, share, and subscribe with your friends, with your family, with your loved ones, because we're covering topics that are so critical that impact not just you, but someone else that you know may desperately need what we talked about here today. So if you know of anyone that is dealing with an addiction of any kind, please share this podcast with them. And, of course, you can find us at the Bare Naked Podcast on all of your socials, including Instagram, Facebook, Snapchat,
Snapchat, you have a
X.
Snapchat too?
We in there somewhere, but and YouTube, this is where you can find the video version of our podcast, and then of course on all your listening device, wherever you listen to your favorite podcast, on Spotify, Google Podcasts, Apple Podcasts, we are there. All right. So again, thank you for joining us here at the Bare Naked Podcast. Until next time, I will leave you as I always do. Be the light that shines in someone else's darkness. Thank you so much.